How safe is cosmetic upper eyelid surgery?
A lot of people with tired-looking eyes recognize that their upper eyelids are more hooded than they'd like. Excessive hooding of the upper eyelids is often a genetic trait, as well as a natural part of facial aging. In the pursuit of information about upper eyelid surgery, patients have reported to me that they have learned about some very unsettling complications when they did their research. For example, they want to be assured that they'll be able to close their eyes or not look surprised all the time after surgery. I'll discuss my approach to cosmetic upper eyelid surgery and what I do in my practice to help my patients safely look their best. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform a wide range of cosmetic upper and lower eyelid surgeries in my practice, such as upper eyelid blepharoplasty for hooded eyes and double eyelid surgery for Asian patients who want more defined upper eyelid creases. For lower eyelids, I frequently perform lower eyelid blepharoplasty through an advanced transconjunctival technique, so there is no incision in the lower eyelid skin. I also perform eyelid procedures not usually performed by general plastic surgeons, such as eyelid ptosis correction and lacrimal gland prolapse repair. As a referral specialist, I also perform revision surgery for complications of eyelid surgery previously performed by other doctors. Safety in upper eyelid surgery starts with recognizing that the eyelids protect and support the function of your eyes. This means that any eyelid procedure can affect the health of your eyes and even your vision. For example, a common concern expressed by people considering upper eyelid surgery is that they look tired. Looking tired can be due to excessive skin over the eyes, which we refer to as dermatochalasis. Looking tired can also be due to the eyelids that are too low, a condition called ptosis. You can have both dermatochalasis and ptosis at the same time. If a person has ptosis and only has skin removed, they can have difficulty with eye closure and still have ptosis after they had surgery. Ptosis surgery is mostly performed by oculoplastic specialists and not by general plastic surgeons. This means that a lot of people are still looking tired after undergoing eyelid surgery. I've been seeing a good number of patients who went to well-known surgeons and are unhappy with their results. They tell me that they met with the surgeon very briefly in consultation, as well as before surgery. This is not enough time to do a proper eyelid evaluation, particularly for ptosis. These patients were essentially receiving cookie cutter surgery regardless of their anatomy. This cookie cutter approach is not limited to upper eyelid surgery. Oftentimes, both upper and lower eyelid surgery is performed together. I see patients who come in with difficulty closing their upper eyelids and also having retracted lower eyelids. This can cause the eyes to be exposed during normal blinking and the eyes staying open when sleeping. This condition is a vision-threatening situation since exposure leads to potential infections and even scarring of the cornea. In addition to excess skin and upper eyelid ptosis, I also evaluate the bone structure around the eyes. For example, the upper eyelids can have a hollow appearance. In situations where there is hollowing of the upper eyelid, I can just add volume with a hyaluronic acid filler. I recall several patients recently telling me that by restoring volume in this area, I gave them back the look they had when they were younger. The take-home message is that eyelid surgery has uniquely complex variables that require time to assess and determine the types of procedures that are appropriate for you. Over the decades I've been in practice, I saw a lot of eyelid surgery complications in patients who had gone to volume discount plastic surgery practices. This in a way made sense since they were buying low quality at a low cost and taking their chances. Recently, I've been seeing more complications in patients who went to high-priced surgeons. Unfortunately, both groups of patients share a common experience. The operating surgeon saw them very quickly in consultation and barely spoke to them on the day of surgery. Some patients report being talked into having upper eyelid surgery even though they were not concerned about their upper eyelids. They defer to the surgeon's expertise only to be dissatisfied and, at worst, having difficulty with eyelid function. As I mentioned earlier, cosmetic upper eyelid surgery is unique among cosmetic surgeries, as the difference between a successful result or outcome and complications can be measured in millimeters. In my practice, I routinely perform all my cosmetic surgical procedures, including upper eyelid blepharoplasty, with local anesthesia with light IV sedation. This allows my patients to be able to avoid the risks and complications associated with general anesthesia, such as nausea, vomiting, and brain fog. Our patients typically go back to work in 1 week. Safe cosmetic surgery comes down to training and experience. Terms like board certification are not adequate to communicate a surgeon's level of expertise in a specific area. I encourage people to get to know the prospective surgeon's area of expertise so you can make an informed decision. Artistically and safely performed cosmetic upper eyelid surgery can make a remarkable impact for your appearance. Although complications can occur with any kind of surgery, proper evaluation combined with communication with a surgeon who has expertise and experience improves the chances of you having a satisfactory result. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.